But secondly, you're going to understand, why did doctors get into business? They didn't do it for the big fat paycheck, man. You didn't go to school for 14 years because you thought, man, I'm going to go get my big house on the beach. I'm going to do this. I'm going to do. No, you did it because you wanted to help people. And this, what we're talking about now, and that's what Doc keeps talking about, and that's what I really want you guys all here, is that their why is just like our why as a small business owner, right? Their why was to help people.
Welcome to the Small Business Safari, where I help guide you to avoid those traps, pitfalls, and dangers that lurk when navigating the wild world of small business ownership. I'll share those gold nuggets of information and invite guests to help accelerate your ascent to that mountaintop of success. It's a jungle out there, and I want to help you traverse through the levels of owning your own business that can get you bogged down and distract you from hitting your own personal and professional goals. So strap in, adventure team, and let's take a ride through the safari and get you to the mountaintop.
All right, everybody, bend over, get ready. It's time to get your physical on. We're going to talk to a doctor who is going to revolutionize how you think about medicine, what you think about healthcare, what you think about how healthcare should be administered, and how you actually, as a small business owner, are probably going to miss out if you don't understand how this whole thing works. But it's going to be a good time. But before we get to that, so I hate that my doctor's actually in here because I had to fill all these forms, and they said, how much do you drink? And I went, occasionally.
Oh, so you really are his doctor?
No, he's not my physical doctor. No,
Okay.
but
Not yet, but eventually he will be mine.
yeah, especially if I'm trending this way. But it's like, do you drink? Occasionally. Do you smoke? Oh, never. No. And how often do you work out? Oh, every day, 2 hours a day. So now he's seeing the real thing. He's down here in the basement with us, seeing the big liquor wall behind us, and seeing that we're having a bourbon while we talk. So there goes the myths.
Because there's a pill that'll fix everything, right?
Without a doubt. It's the easy button. Although I tell guys, I mean,
Think of the excitement in Chris's face.
Thank you.
So yeah, I'm a urologist by training, and I generally tell people, how do you know you're an alcoholic? Is if you drink more than your urologist. So far, you're okay.
All right.
But there's still time.
All right. Thank you. I need it. All right. We got Dr. Bryan Hill.
With some good jokes.
This is going to
I
be
like
fun.
doctors with good jokes.
All right, Doc. It's exciting. We got Dr. Bryan Hill, who, as just mentioned, he is a urologist and practicing urologist and still practicing. But he's had this revolutionary idea and he's developed it. And we're going to talk about that because it truly is revolutionary. And I bought into it and have my family on it and getting ready to put my whole company on it. This is something that again, you want to rage against the machine. You want to change things. Do not start protesting. That's bullshit. Right? That's not the way you make change happen. You make change happen by finding some revolutionary idea, getting it out there, and then telling people about how cool it is. So with that, Alan, let's get started.
You got serious on me for a second.
I did.
I was back to the urology jokes.
All right, let's go back to urology. Well, actually, all right. So Doc, right, you're growing up. You grew up in Virginia. And I mean, how the hell did you go, yeah, I'm going to work on urology? And I love how they use the word urology. And where did that name come from? And why didn't it come out with what we're all thinking?
Well, nobody could actually say that. I was going to put that into a podcast, but I probably won't say that.
No, go ahead.
Yeah. Well, it's the dictor kind of thing. I mean, you're a doctor, but did I say that? I'm not sure if I was supposed to. See, now everything from here forward is gone. I mean, the whole, it's my credibility is shot. Yeah. So urology is fun. I mean, in the end, just as far as going into medicine, I think I told you we were talking a while back, Chris. I mean, I love medicine. Medicine's just an awesome place to be.
Urology is fun. I never thought I would hear that sentence.
I've got great voice.
Well, for you.
Yeah.
Not for the end user.
Oh, when I get
end users. I get it. Hey, look at you coming in with a pun. Right. But growing up,
yes.
How were you introduced to medicine, and why did you determine that was your path?
It's kind of interesting. There really wasn't anything in my lifestyle, my upbringing. I mean, I was a kid of a FBI, guy as a father. I never had anything that really kind of had that aha moment that, oh, you need to be a doctor. It was just on my heart. I mean, I remember telling my parents when I was 5 years old, I'm like, I'm going to grow up and be a doctor. And of course, my parents were like, "Sure, you go out there and you pick your nose and run around the backyard, but you're going to be a doctor, no doubt." And so, but no, it was just always one of those things that I just knew I was supposed to be.
So, where'd you go to school?
So, I went to a small school for undergrad in Virginia called Eastern Mennonite University, And then after finishing up there, stayed in Virginia, went to the Medical College of Virginia for my medical school training. We had the Knife and Gun Club at the time. At the time, Richmond was the number 2 per capita murder capital in the world. So just behind New Orleans.
Wow.
Yeah.
So you obviously got a lot of experience.
Little hands-on training there.
Yeah.
It's always kind of good to pick that out. And then, go ahead.
Medical school, so that's 4 plus 4. Wait, hang on. That's 8 years.
Yes.
For most of us who are normal.
I'm sorry.
Higher math.
So how much is that?
No, you're doing a great job counting on this episode, Chris. I'm just still laughing at the fact that he's got great toys, which is kind of sadistic. And then, yay, I happen to be in the murder capital of the world. And so lucky me.
You can see how you got to be geared to be in medicine, right?
Yeah, that's
I
right.
mean, clearly, you got to have a good sense of humor, and you got to really love other people's
There's
blood.
a little bit of Schadenfreude going on here, right?
Mild amount of insanity, but to do what we do in this world, you have to be a little insane, and to think differently, you have to be willing to walk in that, lock, stock, and barrel.
This is going to be
All right.
good.
So you do 8, but then you got to, for this is a specialty, right? So you have to go more.
So I did. So I finished up my 4 years of medical training, and then went and did my residency in urology. That was a 6-year program. Did that at the University of Maryland.
Good
So about what is that, 14 years in post training on board.
Yeah. So clearly dedicated, right? Willing to put the time in. I think we figured that out.
I wish I knew him better. There's so many jokes.
Right?
I know.
And he went to Maryland for that. Which when I think of Maryland, what do you think of? Crabs. You're like, oh, where are we going now? I don't know.
I think at that time, Maryland motto amongst the medical community was the city that breeds, and so I guess there was a significant amount of STDs in the world of Maryland. But fortunately, that was not my world.
All right.
I operate.
So you get out, and then you do what every doctor after 14 years in. It's time to go make some money. So what'd you do?
So I did. So I actually looked around the United States, figured out where I wanted to go set up shop, had an opportunity to kind of decide where we wanted to go. We found that Atlanta was interesting, intriguing. So we decided to come to Atlanta, joined a medical practice here, a urology practice here in Atlanta, started working, and got to know my wife because we had disappeared, from each other for about 10 years there.
Yeah.
So, all right. So the lady you're still married to was here when you first got started doing it. Wow.
She's been with me since, finishing undergrad.
Wow. You were the potential.
Yeah, I guess that's the word.
You had higher potential earning power.
Now she's looking at me going, really, him?
Is this who I waited for?
Yeah. In all those years.
All right. So you come to Atlanta, you start, you get into it, obviously very successful. And it's a great way to make money. I mean, you put all this time in, so that's awesome. So you're doing this thing, and then you have this idea. How did this idea come out? And then let's talk about this one now.
Yeah. So no, great. So started working for a little bit. Like I said, it was a matter of kind of hopefully paying off a little debt from medical school residency, getting know my wife a little bit. But to be honest with you, you realize very quickly when you come out of practicing medicine that what you're working in is a healthcare system. And the healthcare system is not necessarily about healthcare. There's all these other players kind of into the mix. Things you're never taught or trained about, as you kind of go through medical work. And so it was very apparent very early on that the healthcare system was a mess. And I'm somebody, as you guys will find out, has a very big mouth and a very short willingness to sit by and kind of let things run sideways. And so soon thereafter, I decided to engage in some policy think tanks. Started working here in the state of Georgia on some think tanks. Started trying to figure out where are the issues in our society. Always had a bigger idea about footprints in the world, and so kind of that foray into think tanks, policy making, made me delve in to start thinking about healthcare certainly more and more. As an MD on a think tank, you're going to be couched into medical. And that love and passion of medicine kind of bore through to the point where we said, you know what, healthcare is a mess, and how do we go ahead and try to make this morass better? And that was the foray of really jumping into finding something better.
This is a big one because I would say right now you're trying to tackle like a monster problem that's bigger than my thinking, which doesn't mean a whole lot because I definitely didn't go to school for 14 years, like Doc here did. But that's a big ask, right? To go, I'm going to go, I'm going to go fix healthcare in the U.S. And oh, by the way, I'm not the president.
Yeah.
So as you jumped into this, was it naivete or did you feel like, I really think I can make this needle move?
I think we can make the needle move. I mean, it's both, right? Anytime you build something, you're going to go, it's both. But whether you start a small business and you come in with the naivete of going, oh, this is going to be easy. It's not going to take a lot of time. It's not going to take a lot of money. It's easy. Well, nothing is easy in this world that's worth it. This is the same thing. And so thankfully, the naivete kind of said, yeah, let's go ahead and try to make an effort at this big, hairy, audacious goal. But certainly it was a bit of an eyes wide open that I had spent some time before we kind of really started building out, our company, working in the policy world and looking at the structure of the healthcare system, seeing these stakeholders that are at play in the healthcare system and realizing how intransigent it is, but was not deterred because, again, I go back to, I am just too unwilling to sit back and be quiet and not try to fix something.
I mean, this is a big, for me, you talk about.
And I know you love this when I have no idea what bomb is about to be dropped. I mean, I know this is a big pleasure of yours, but what is it? What did you do?
All right, Doc, what'd you do?
What'd you do?
Yeah, so very simply, and I can't say simply, I don't think. It is pretty simple.
You
No,
suck so bad, Chris.
I know. I didn't let Alan prep for this one.
I mean, and I texted him earlier in the day. I'm like, what are we talking about?
Don't worry about it. It's going to be great.
No, he didn't even say that. He just pretended like he was working.
I did pretend like it was working. All right.
But I think the good thing about that, Alan, is it kind of just allows you to kind of hear what we're talking about and from your side interject and like I said, I think provide value of wait, what the heck did Bryan just say? Does it make sense?
So just for the audience, he's got a serious Bill Hader thing going on, don't you think?
Oh, he's definitely looks like Bill Hader. Yeah, man.
I got a little Jim Carrey every once in a while.
Yeah.
But yeah, I'll take the Bill Hader.
Okay.
Yeah, he's younger.
He's younger. Yeah.
Yeah.
Is he sexier? I don't know if he's sexier.
Yeah, I don't know. I don't
call that to the guy.
Yeah, you're actually too straight
personal.
so it's hard.
I would say if you had to say one of them was sexy, it'd be Bill Hader over Jim Carrey. I don't think.
I guess I would. Yeah, I guess I'd do that. There you go. So
Ace Ventura.
we got a new podcast coming up.
I just had to get you guys a new idea on the podcast. I don't know.
Straight guys rating hot guys. I think we got a new podcast, Ellis. All right. So what is
It's going to take a lot more bourbon.
Oh. HipNation.
Yeah. So I'll step back and give it a 30,000 foot, maybe a little bit to your question, Alan. I mean, so I always tell people, what is healthcare in today's world? And what do we see when we kind of think about healthcare? And healthcare really is, a tale of the health insurance industry that's wagging the dog. So healthcare, when we generally think about healthcare, is we go, hey, we're taking money. We think about health insurance, right? We're taking money and putting this money into this pot. We call it premiums. We're going to put it into this pot that is called Blue Cross or United or Cigna. And that pot of money is going to be used to go out there and help me buy healthcare. And that's the healthcare system. We call it, right? We've got a third party payer kind of in the middle of all of this. And so all of the money that we put together in healthcare is funneling through, right, this third party. And that third party takes your money and takes your money and then says, okay, now Alan, you're going to go see Bryan. And oh yeah, by the way, I'm going to pay Bryan your money, but I'm going to filter a whole lot of effort and work and costs and everything in the middle of that. And I'm going to tell Bryan what he needs to do to take care of you. And I'm going to make it really, really expensive because all of those interactions have an awful lot of people in them. And we said, wait a minute, why in the world are all of these people standing in the world of healthcare and making things exorbitantly expensive? Maybe if we rebuilt healthcare the same way we kind of, buy everything else in our world through direct contracting and direct working with the people who provide us a service, maybe if we got rid of all those middlemen, maybe, just maybe, the cost of healthcare would drop like a rock. And maybe doctors would start listening to people, instead of the insurance industry. And maybe we can make the healthcare a little bit more affordable and a little more patient-centered and, I don't know, change healthcare a little bit.
Sounds easy, Doc.
Sounds easy,
Come on, start asking questions.
Well, and when I think about the crazy cost of healthcare, I realize you've got that middleman totally trying to make money, obviously. You got a doctor who's trying to make money, and then you have new technology and the ability to spend gobs of money trying to fix one person's issue that maybe 30 years ago we couldn't fix. And I don't want to sound so just so clinical about it, but so where am I going with this, Chris?
I don't know.
You know what I mean?
So, all right, let me help you a little bit. So,
yeah, please.
We pay the doctor who did 14 years, paid a lot of money to get this training. We pay him, and he should be paid, right?
Right.
I mean, nobody back in my world, right? I went with a cheaper option. Oh, good for you.
Well, and you think about
it, you're dealing with urology.
With
I went with the cheaper doctor.
The total
what the hell?
socialized medicine, and the doctors aren't making very much money. I want our doctors to choke on the amount of money they make. I want them to make a lot of money because I want the best people, the smartest people to become doctors.
100%, right?
Yeah.
This is one thing you don't go, I got 3 bids. I went with the cheapest one. No. But so I want that guy to make that money. The guy looking at me,
Yeah.
the lady looking at me, whoever. But what Brian's talking about is, so he has to use a special billing code. And if he uses the wrong billing code, now he has to be trained.
Oh,
in
it's a
all the
bureaucratic nightmare. But I guess what I was getting at earlier, just to kind of try to crash land that plane, is, with the general rising cost of healthcare, you also have all this new technology, and to treat certain diseases and issues can get really expensive. And since we're all in a pool, we're all, all of our rates go up because we're paying for a lot of stuff that we used to not even be able to do.
But you're saying like 50 years ago, if I had an ailment, like perhaps I drank a little too much and I was going down, today I'm going to get saved by a pill. But 50 years ago, I'm dead.
Yeah, you could put it
and
that
I should
way.
be dead.
Yeah, I think you kind of, you got what you deserved at that point.
But I'll ask you this, right? So we've got this beautiful, right? I've got this beautiful piece of technology in my hand. I'm sitting here looking at my iPhone. Unbelievable piece of technology. Didn't exist, right? We took somebody to the moon with technology less than this. Yet I can sit here and hold this wonderful piece of technology in my hand that can talk to anybody around the world, can text anybody around the world, and it's affordable.
Right.
Why? Right? Why is an Apple phone affordable that everybody, right, in the United States and pretty much around the world, right, has a smartphone?
So
great technology. So is it a technology issue, or is it how we actually buy things, how we pay for things, the price transparency, the competition in the marketplace, right? Maybe it's that I don't have a third party helping me buy my iPhone, right? That iPhone actually has to respond to me as a consumer, and it's got to create a price point that's actually affordable by me. And maybe that's some of the secret sauce that we need to put together into the world of healthcare.
So this is why I bought into it, because we both said the same thing, and we'll just say it again. And that's what Doc was just saying. I want the specialists to get paid what they deserve, 100%. But I don't need 25 people between them and me getting paid along that as well. And as somebody who did consulting work, and I actually worked for a very short time with healthcare companies, but most of my time was spent in financial services. I will tell you, some of those buildings that you go into, that some of these big providers that we just talked about, are immaculate 1,000% Taj Mahals. And you're like, wait a minute, my healthcare premium just paid for that. It didn't pay for the doctor that I get to see, or I'm sorry, and my daughter's about to be a physician's assistant. I'm not going to bang on this. I love my PA daughter, but I get to see a PA after I wait for 45 minutes, and they say, I'm sorry, after 8 minutes, you have to go. So I didn't get this. They, who I want to get paid a ton, got to see me for 8 minutes. But they're being told, hey, to make your numbers, we need to have a bunch of people flowing through this office so we can bill, because we have to pay the healthcare companies for the billing rates. And so all the money goes off, and it's not the one helping you and me sitting in our office.
Yeah, it's very transactional.
Very. And an expensive transactional process, right? That becomes part of the problem, is that the ability or the way that I get paid as a physician is very expensive. The transaction is, again, happening through a third party, not from you paying from me directly, right? But it's filtering through, to Chris's point, all of these middlemen that are standing in healthcare that are doing the coding and the billing and the prior authorizing and pre-certifying and denying claims because you put the wrong code in, or you didn't check the right box, and that's going to come back to your office, and then you've got to refile that bill again, and you're going to try to get paid 90 days later from that office visit that was $120. Why am I running that through an expensive bureaucracy that's an insurance industry? And if I do all of that, and I've got to keep all of this back office administrative costs to try to get that money back in the door 90 days later, my gosh, I've got to see an awful lot of people in order to generate the revenue. And I'm going to be working until 2 o'clock in the afternoon or 3 o'clock in the afternoon just to pay overhead costs and pound as many people through my office, so that maybe the last 3 or 4 people a day I see, they're actually people I'm putting in my pocket as making money. Right. And so we've created a system that is so ridiculously expensive and requires just a volume of throughput of patients in order to try to cover your overhead costs and then get a little bit of money left over in the back end. If we go, wait a minute, maybe if we actually made it easier for that transactional process to happen, for physicians getting paid for the medical care they're providing without it running through that huge bureaucracy and all the back office and all the administrative costs, maybe my doctor can see less people because it's money that's not flowing out of the system. It's staying with them. Maybe my doctor can actually get paid a little bit more. Maybe my doctor can actually focus on me because he's not trying to run me out the door, or she's trying to run me out the door in the next 7 minutes because I've got to hurry to get through all these other people. And it's just going, if we can get rid of this ridiculous middle that's been built in this transactional process that is healthcare, the cost of care can drop like a rock. And the quality of care, because now you become the center point of it rather than the insurance company, can improve. And so it's really a matter of, we say, right, this intermediating what has become this very expensive sclerotic middleman called the insurance industry that takes over
He's been
healthcare.
using some big words, but okay. So
Sorry.
outside of going to back to paying cash or bringing my cow or a couple of chickens to get my unit worked on, you, oh my God.
It's coming right back. He's a urology doctor. We're talking to like total body health things.
I mean, what is the solution? Because you do have people, I mean, not everybody, the whole idea of the insurance is to kind of spread out the costs. So I get lucky and I'm reasonably healthy. I don't cost the system much, but Chris with his Caligula-like lifestyle just is a real drain on the society health-wise. And
hypothetically, again,
oh yeah, I keep forgetting to use that word.
Hypothetically, please.
And
Docs in the
let's
room
say,
with stuff.
let's
I mean, I
talk
can't
about
say everything I usually say.
just an imaginary person whose name rhymes with Chris. I keep
Thank
forgetting to do that, but so you
Thank
have
you,
to
Al.
have. It seems like maybe you've got to. I can't wait to hear what you have, but there has to be some sort of blend between me paying with chickens and this bloated behemoth.
Yes, then there is. And right, the bloated behemoth is an unnecessary animal now in today's world that doesn't do anybody any good except for themselves and maybe their shareholders, right? That's just the reality of the insurance industry. Take an awful lot of money out the top, make it really difficult for us to, as medicine, provide medical care to you all, and make it really expensive for you to buy their product called health insurance and to make healthcare, my product I sell, really expensive. So we go, let's stop that. Let's rethink healthcare a little bit and take this concept of insurance and put it aside, for a second and go, if I wanted to make healthcare itself efficient and remarkable, right? How would we just build that first? And for employer groups who are spending, right, second biggest bottom line item on their P&L, right, is their health insurance. And it's the one they can't control. And it's the one that's going up all the time.
Mm-hmm.
You follow maybe oftentimes, right, your payroll, and then you got your right health insurance premiums. And so we go, if we wanted to rebuild this and make healthcare first valuable for people, powerful for people, from the side of medicine, I would tell you, and as we've expounded upon, I'm a urologist, but I would say the most important person in your healthcare existence and the existence of our society is your primary care doctor. So let's just first focus on what studies consistently show around the world in health systems, looking at the functionality of health systems and actually improving the quality of care and having their right society live longer, happier, healthier lives. Primary care has been shown to be right the linchpin. Well, except in our world, those primary care doctors are running around seeing 22 to 25 people a day. They're miserable, spending half their time dealing with an insurance company, right? Can't stand what they're doing prior authorizations. They're burnt out. 60% of doctors are burnt out in medicine. And they're going, wait a minute, I grew up to be a doctor because I'm going to bill an insurance company and spend my time focusing on them. We go,
Right.
That's awful, right? So let's rewire that product. And let's do this instead. Let's just have primary care walk away from insurance. Nobody's going to go bankrupt, right, with their primary care doctor. I mean, what's the point of insurance, right? High cost, catastrophic event.
Mm-hmm.
I haven't seen a primary care event cause somebody to go bankrupt. So we go, let's have doctors in the primary care space walk away and just direct contract with you and you. Buy service, just set up a membership model.
Do you have what it takes to start your own business? Are you tired of the 9-to-5 corporate job and ready to make that leap into entrepreneurship? You need to check out From the Zoo to the Wild, the book by successful entrepreneur Chris Lalvani. This book is a unique perspective on the journey into the wild world of home services and delivering excellence in service while working in customers' homes. Lalvani shares his path to success in this industry, including proven customer relationship strategies, award-winning customer experience processes, and a unique approach to training a team of service technicians to perform at the highest levels. Whether you're a small business trying to scale or a franchise operation, From the Zoo to the Wild will give you the mindset, habits, leadership style, and customer-oriented processes to succeed as a small business owner in the world of home services. So if you're ready to take control of your future, get a copy of From the Zoo to the Wild today, available on Amazon.
Pay like you go pay a gym.
Which I am hearing a little of that.
So,
is.
so here a couple things that I love about what Doc has built and done. I mean, he's bucking against the trend. So hang on, if you got a small business, stay with me, man. I know you're in your truck, you're rolling, you're trying to figure out what the hell's in it for me.
Yeah.
There's two things in it for you. Number one, you're going to learn about how a guy saw an idea and bucked a trend way bigger than all of us, bro. I'm telling you, all of us and gal. But secondly, you're going to understand, why did doctors get into business? They didn't do it for the big fat paycheck, man. You didn't go to school for 14 years because you thought, man, I'm going to go get my big house on the beach. I'm going to do this. I'm going to do. No, you did it because you wanted to help people. And this, what we're talking about now, and that's what Doc keeps talking about, and that's what I really want you guys all here, is that their why is just like our why as a small business owner, right? Their why was to help people. And in the world that they're creating now, you don't see that why. And if you were ever in corporate America and you paid your premiums and your company paid a half to a third, or back to when my wife was at IBM, they paid for all of it back in the day, Big Blue. We didn't even think about it. We're like, whatever, we were young, we were healthy. But you saw your doctor, if you were lucky, for 10 to 15 minutes. And so what Doc is saying is, let's put this back to the general practitioner. So you went for an extra 6 years. These guys go for still 8 years. But when you go see them, and I sat there for 2 hours talking about everything that I have going wrong with me. And believe me, we could have gone for 8 hours, Alan. I know that's what you're saying.
Cliff notes, huh?
I did do clip notes, and the whole time going, how much you drink? Occasionally. So anyway, and thank God they didn't have lie detectors. I swear to God. But
It's an idea.
yeah, actually, after hearing this, you're probably right. But no, and so far, my wife's been there. My kids are scheduling a trip to come back and do this as well. And you're right. It was the first time in my medical life where somebody actually sat there, listened to me, talked to me, and then started offering advice. No, let's do this, let's do that. Wait a minute. Hey, instead of just saying, let's throw pills at it or do this. And so for me, I got better care, and I'm directly paying for my best care through them. Now, as a small business owner, I have never provided health care for my company. And now, for the first time ever, I can see it as an affordable option for me to be able to do it. Because in my world, it's very hard for me to compete and offer health care.
Mm-hmm.
And I can't do what Big Blue did. I mean, again, my handyman rates, and some people in this room will tell you that I charge a lot of money.
Are you really looking at me?
No, you do use me. But we get it. I mean, we get it all the time. I'm like, well, I went with a cheaper option. I'm like, all right, we're a handyman, so I get it. But if I layered in healthcare, I would be even less. And it's been hard. It's hard for me to offer that to provide this. Now I got an opportunity where I go, I think I got a way to do it, and I got a way to actually keep my people healthier, because I'm putting the power back in the people I want to have the power in. And that's the doc who's been trained to, again, play to his why or her why. And that is, I want to help people. So that's what this.
So basically you can contract per employee for, like some sort of an annual contract, is it?
No, it's monthly.
Pay per go.
Right. So the way it is, again, it's still a monthly thing. So the program, and I'm going to jump to it now. So the program that you would have, if I went normal healthcare world, they would like, okay, here's my healthcare. Here's, pick one of the big 4 or 5 that are out there. You get to offer that to your company. By law, you have to do 50% because you're going through us. Our numbers start in the 400s and go up. So now you have to pay $200 per employee. It's a non-starter. And then I ask my employees, are you willing to pay $200 a month for healthcare? And they're like, no. And Doc is sitting here shaking. They won't do it. And not unless you're going to pay for all of it. I'm like, well, if I pay for all of it, then we're not going to have as many jobs, and I probably can't employ all of you guys. So they're like, then we don't want it. All right. So I don't do that. I started looking at this option. If I do this, I can pay whatever is allowed, whatever I feel that I can afford, and ask them. But here's the deal. I didn't start at 400. I started at half that. Okay. So now I ask the guys, can you pay $100 a month? Yeah. All right. I'll do it now. And you're like, okay, now I have healthier employees, and I have handyman, I have remodelers, I have project managers, I have office staff. And they're like, yeah, I'll do it. All right, well, here's how the program works. And here's what you get. So it's not all panacea. right? But it's also more appropriate to the way it works. And these guys go get and meet with a primary doctor, and they get time with that primary doctor. And now they learn about what's going on. And when they say, I have a problem, now we can talk about that. So where does it happen? Here's where it happens. So these guys, what they do is HipNation here in Atlanta. And now you guys are, how many states are you in now?
12.
12 states. So they had this idea. You pay a lot less per month. You get access to your primary doctor, who Doc said was your linchpin. And I'm speaking for him because you got to hear this. And then if you have a major event, so their example, and an example is I broke my leg. Now what? Well, you go into the ER and you do the thing. You come in, you tell everybody, I'm going to self-pay. And here's where the crazy stuff goes
So
down.
they teach you how to work through the system?
They didn't teach us how to work through the system. I'm going to tell you, I already learned how to work through the system because I told you I didn't do healthcare, right? Watch this. One of my guys in my truck had a heart attack on I-575. If you don't know 575 here in Atlanta, it is a super speedway. It's just blanketed as a highway. So he was going 90 miles an hour and started to black out. He got the car under control and got off the road. He had a heart attack. He went in. I did not offer health care. He went in there, and what he said was to the doctors, and they came in and they said, well, he said, I'm going to have to self-pay. So what did they do? They put him through, they take care of him, number one, because that's what hospitals are supposed to do. Thank God. Again, they're why, right? You got to the people. And then after it was done, it was like, all right, we got to figure out how to pay it. And I can't. They go, all right, we're going to put you on a payment plan. Okay. So the payment plan, he will probably pay until he dies. So go ahead,
But
Doc.
not us. So I'll throw this for guys that are listening and businesses and gals.
What I meant by he's going to die 50 years from now.
Yeah.
I mean, the guy, he's still healthy, still working with me. This happened 3 years ago.
So I'll throw, so the why that you all hopefully should be listening and maybe why I was hopefully asked to be here is we do have a heart for businesses. We really want to see two things happen for businesses. I want them to be able to bring a high quality, affordable product to their employees. And that's what we've built for employees in businesses. And I want their employees to get great healthcare. Right. And so, part of what we're the mechanics that we can talk about a little bit, the what undergirds the economics of how we work, is kind of what we were talking about a little bit before. But what the economics drive is that we can go to an employer group and who can be on Blue Cross or United or Cigna, and we can say, walk away from that. Stop paying ridiculous premiums. I talked to an employer group today. They're paying $800 for an employee only on their insurance plan. You go, walk away from that. Stop paying that. Half your employees can't afford it. Most of your employees can't afford it, even if you're paying 50, 75%. Stop wasting money they're going to the insurance company, and let's instead have you join our model of how we provide and how we believe healthcare can and should work. And our model is based on two pillars, and again, huge cost savings that are going to come from the employer and the employee by working on our platform and using the way we work. One, everybody's going to get that access to a great primary care experience that Chris talked about. Our primary care doctors take care of a couple hundred people instead of thousands of people. Our primary care doctors see 6 or 8 people a day instead of 25 people a day. We do that because our primary care doctors have walked away from insurance and all the ridiculous bureaucratic cost and join us. And their job is to do one thing and one thing only: take care of do a great job taking great care of a small number of people. Give them your cell phone. Give them unlimited office visits. Give them access through texting and telemedicine, right? And just go be a doctor. And because I'm not billing an insurance company, because of all of those administrative costs are going away, our doctors can actually get paid well because we're not funneling money out to an insurance industry. It's staying in the office. And if our costs are
billing less and keeping more.
and I'm not billing at all because it's a monthly membership. It's easy.
But they keep it. Again,
Easy.
where do I want to go? I want my money to go to the person who's taking care of me, not the person 5 states away who's administering and doing all this stuff. So
So that's the first piece. Let me hit you. So if you don't mind, Chris,
keep going.
So
Go.
that first piece of going great access, great primary care. But then the other pillar that you mentioned there, and the way we access healthcare is how do we, if I leave my primary care, and it's included in our product, right? There's no additional charges included in our monthly cost. But if I leave that space of the primary care, because bad things can happen to our bodies, and I maybe need a CAT scan or an MRI, or maybe I have a heart attack, or maybe I need to have surgery, right? The question becomes in that space, right? One, how do we pool dollars together, for an employer to make sure that we've got the money to be able to pay for that medical issue? Well, one thing we've done is we've helped create this kind of a co-op style model where we take employer groups and pool employer groups together and go, let's pool our dollars into this fund, and we use a platform that's called medical cost sharing, which is almost like crowdfunding. And we go, let's pull all of our dollars together and put them in this fund, not give them to the insurance company, but let's do it ourselves because, as we mentioned, insurance companies are expensive and costly and drive us all crazy in healthcare. Let's do it ourselves. And now that we've got this dollar in the fund, how do we want to go and purchase those healthcare services in the world, the x-rays and the office visits? Well, we can buy it through an insurance company. But again, we talked about all the chaos that comes with buying things through an insurance company. Or we can do something really simple. Medicine is willing to offer their services, me as a urologist, and hospitals and imaging centers and ambulatory surgery centers, we're willing to offer our services at a discounted rate, significantly discounted rate, if you pay me today. If you don't make me have to fight with an insurance company and carry 60% administrative costs to try to get money in my door 90 days later, I'll give you a discount. And so when we go out and we say, all my primary care is included, but the per unit cost of care, when I step out of that office, I'm going to be buying it as a self-pay customer and buying it at that 30 to 75% discount. Now I'm buying healthcare at its real price because I'm not funding the middleman of the insurance costs in healthcare. I'm just buying the service. So now the price per unit of care drops. And now we talked about with Chris, we've got this money in this pot, right? Our crowdfunding kind of pot. And we go, oh, great. Bryan's business is in this, and Chris's business is in Alan's business. We're all in this pot together. And we've got a lot of businesses around the United States that have their money in this pot here together. And if, God forbid, something bad happens to Alan, we're going to use the money in our pot to go buy that medical care for Alan. We're going to help give you the funds to do so. But we're going to buy it as a self-pay customer and pay for it at its real price and make sure the medicine gets paid quickly and easily and efficiently rather than having to fight 90 days later to get paid. And since that cost of care is less in that way, the premium that we charge, the monthly, we call it a contribution, that monthly contribution drops by 50 to 60%. The cost, right? So
let's talk real dollars in this one. So the scenario I just talked about, and this is the one that we actually used to figure out if this is going to be a good fit for me. He did have a heart attack. It was 3 years ago. He is on a payment plan, and he's on a payment plan literally until, again, he passes, which hopefully will be 100, maybe 90, but whatever. In this scenario, had he been on a healthcare program that I would have been able to offer to him, he would have been in. He would have been paying $150 to $200 a month. And then in this situation, he would have come in and said, hey, sir, how would you like to pay? He goes, well, I'm going to self-pay. I'm going to pay you today. They went, okay, well, instead of charging you $300,000, we're going to charge you $100,000, a third. It would have been a third.
Yep.
Check this out. And by the way, his contribution in this deal would have been $1,000. He would have had to only pay $1,000 to that, and he's done. He's out. He's not having to pay for the rest of his life.
Our fund pays the rest.
The fund pays the rest. But you see what the hospital system just did. They're like, oh, you mean you're going to pay me today? I don't have to do these stupid billing codes and 75 billing codes and make sure I get paid and get da-da-da. So they took all the administration away because, again, as a small business owner, what are you thinking? Pay me today. I'm going to give you a deal. You pay me cash, bro. I'll do anything to anybody, anytime. You've heard me say that all the time. Oh, I'm going to put, can you finance me? Yeah, sure I can. Let me tell you what that number's going to look like. So they lowered their price it would have been a third lower by self-pay. And my employee would only have been out of pocket $1,000. And then our contribution of our group and the groups that we joined would have paid the rest, and he would have only had to pay $1,000. Today, right now, he's stroking a check every month just for that heart surgery that he had to have 3 years ago.
And I'm processing hard.
It is hard. I'd say
it's hard.
It's a lot to take in.
And I'm sitting
and I would tell you, actually, I put Doc through the ringer doing this. and I'm still putting him through it because I haven't even put my company on it yet. But we met once, twice, then again with my family, and then we joined because I'm self-employed. I had been riding my wife's insurance for years. She's retired, so we had to figure this out. And he got on the phone with my wife, talked her through it all. We've been through it. My kids understand it. My daughter, going to PA school, will be off it hopefully very freaking soon. I mean, this is going on so long, Doc. Again, your parents must have said after 14 years, you were off the.
I was off the payroll for a long time.
Okay, good. Yeah, you know what? Daughters, though, different, right?
Very different.
Dear God. Ay. An Audi, by the way. An Audi. She just got an Audi. Huh?
I thought you were talking about her belly button.
No.
It is a healthcare. It is a healthcare conversation. So yeah, so it's interesting, and to be granular and to give like a business is a granular idea. I said, I mean, most businesses we're seeing today are paying $800 for an employee only. I see employee family plans, and it's certainly in the small business space, we're getting crushed. I mean, they're paying $2,600 for an employee family plan, and that's for these employees to walk around with a $7,500 max out of pocket if I get sick, family $15,000 if two of us get sick in our family, and I'm paying a ton of money to do so. So for us, on just a regular straight employee solution, the one that's the most common that I see employers go with, it's $338 a month. That includes all of their primary care, their doctor's cell phone, no copays for their primary care office visit, an hour and a half with their doctor to talk about life and health and wellness and partner with you to actually really be a doctor in your life. And God forbid, if something bad happens to me, I'm going to pay the first $1,000. I'm going to present as a self-pay customer to choose the right price in healthcare. That's all I'm doing. I tell people when I say I'm self-pay, the healthcare system has self-pay rates. We're just accessing that price on our list of charges called our charge master. I'm going to present as a self-pay. I'm going to pay the first $1,000, and our fund, right through our medical cost sharing platform, is going to pay for the remainder after that. Not $7,500, $1,000.
Is there a little bit of risk? You go one hospital and self-pay rate is discounted a certain amount, and another hospital is discounted a completely. Maybe some hospital doesn't even discount it. I mean, it to me it seems like there's a lot of variables or risk there. So the trust, I don't know what the right word is.
It's not trust. So beautiful. The piece on this is that, and again, this is a physician-built model and mindset around this. The beautiful piece in the space of pricing healthcare is you're right. There is variability, which is a problem, right? But that's a problem a little bit in healthcare. Is why in the world does one hospital cost more than another? Why does one CT scan cost more than another when it's the same CT scan being read by the same radiologist? It just one happens to be housed in a different location hospital, and one happens to be housed in an outpatient imaging center. Why are they radically different prices? And why are you guys not aware of that? We should know that. There should be price transparency in this. And so we believe in, if we can drive that price transparency, we're going to really create some real solutions here. But the variability in that self-pay pricing does occur. I think it's good for people to see that. It creates consumerism. But the other piece is that usually, again, most hospital systems, imaging centers, ambulatory surgical centers, physicians have discounted self-pay rates better than insurance rates. But even the ones that aren't quote unquote discounted, usually what they're going to charge you is the insurance rate. So the worst case scenario is the cash rate is the same as what your insurance rate would have been, as opposed to significantly discounted. And where that impacts is not our member, right? Our member pays the first $1,000. What it impacts is our fund, because our fund is what's paying out after that $1,000. And so if we all want to be good stewards, consumers, and I don't want Chris's pay have to go up, right? His monthly contribution have to go up next year. I'm hoping Chris goes, yeah, I think I'm going to go buy that MRI at $499 over here at First Look MRI, instead of going and paying $3,000 for that same exact MRI at at a hospital-based imaging center.
So I said two things. You don't want to go to the cheapest guy, right? Because cheapest guy would be the worst guy. But what we're talking about is affordable and quality and inequality and gouging and pricing. Yes. So I think one of the questions, if I was listening, would be like, all right, Doc, so I go with you guys. Instead of paying the big guys, I'm paying you now. How come you're not gouging me? I mean, so how come you're not?
Yeah, so we've done two things, right? That's just a great question. So one, our co-op is a nonprofit. So we put together a nonprofit in that co-op. And so that's functioning, and really it's a community owned, membership owned kind of co-op where we put the capital into. So we've kind of said, hey, that's a good way to put money into that. Now I tell people I'm a free market capitalist. I just am. Free market capitalism happens in the world when you bring forward a better product at a better price, grow in the marketplace, and overcome those old stakeholders that are either providing a worse product or a higher cost product. There's lots of room in this marketplace of healthcare to come in at a lower price point. We are, and do very well, which we are. And so price gouging, how does price gouging get controlled? Then you guys go out and buy beer. Well, you see the price of it. You compare against, do I want to buy that beer or that beer? Price transparency and competition in the marketplace is what drives down price.
So this is a really rude, crude analogy, but I love it. So my son goes to UGA. We go up there, and I said, "Hey, I want to go out buy some beer and pizza for you guys because I made them all fix up the house that we own up there." And my son said, "Dad, don't go to this one. Go out by the place you're buying the pizza because you'll find the beer is more like what you expect to pay." And you're like, "It's the same damn beer, this can over here." And so I said, I forgot to get ice. So I strolled in there and I looked, and sure enough, the price of the beer was like double. Why? Because it's closer to campus, and perhaps a nice ID might take care of business. You know what I'm saying?
Yeah, no,
Let's just say I was carded because the cameras are looking. Who's going to card this bald guy anyway? But so that's the point, So I'm not saying it's bad healthcare if you go this way. It's great, affordable healthcare. See, because what's happened is the society that we got into, and we go through everything. And I'm definitely not going to go political because we're almost done with this podcast. But you've got to start to understand that everything comes with a price, and everything, you said it early, right? Nothing in life is worth it unless it's easy. So you did it, Doc. You've done this. Obviously, you get some kickback, you get some deal on doing this. We didn't even get into the business model. We just talked about how good this is. But I feel like your why is double fold in your life. And, not only helping people, but also helping people find great, affordable healthcare.
No, that's our mission. So for me, I'm one of these people that realize I kind of mentioned at the beginning, I'm one of 15 kids. I grew up with 11 adopted brothers and sisters, right? I kind of grew up with this perspective of going, how do we go out and change the world? And I'm blessed to be able to do what I do as a physician. I can't complain about that one bit, but I know that when I pass away, nothing's going to be coming with me when I leave. Let's go ahead and leave a heck of a footprint here on this world. And so my heart and vision is going, how do we make healthcare affordable, for my sister that works at a daycare center? And how do we help my brother who runs an HVAC company be able to afford great healthcare for his employees? I think they deserve it.
So can an individual sign on, or is it just company only?
So we do individuals. So probably about 80% of our business is on the group side, just more businesses, but we do individuals as well. And if I step back and just kind of, like I said, for maybe people that are listening, and just to kind of give you an idea of what we can do, which is just awesome. We had a 15-person company reach out to us, and there was a plumbing company, third generation family company. And they had, like I said, 4 guys that were on their insurance plan through Aetna because they're the only ones who could afford it, right? The foreman and the owners. And the other guys were like, I just can't afford this thing. We walked in there with our solution, for these guys, and said, hey, join us, walk away from Aetna. And when they did, because they said yes, they were able to buy healthcare for all 15 of those guys and still come out $15,000 less per year than what they were paying for 4 on Aetna. We bought healthcare to 15 people, and not only just healthcare, right? We brought a personal primary care physician to those 15 guys and gals. They got their doctor's cell phone, and they didn't even have an inkling of access to healthcare. Now they got $0 cost to go spend an hour with their primary care doctor to talk about life and health and wellness. And God forbid if they get sick, that prior Aetna plan had a $8,000 to max out of pocket. Now the guys get sick, it's $1,000. I mean, right? That's transformational in medicine for businesses, to be able to help improve the quality of care for their employees, improve their bottom line, take that capital to be used for capital expenditures, help them increase the salaries for their employees. I mean, it's just, why are we having so much money go through an insurance industry and taking away valuable capital from a small business? Let's stop that game.
Amen, man. This has been amazing because
I got questions still.
Oh my God. All right.
Yeah, I got
no, we're not stopping this thing. Guys, hang in there. By the way, he's going to tell us what areas he can help you with after this episode and put in the show notes. But Alan,
Yeah, I'm just thinking about this
this
from a business model. How do you even start this? How do you have the capital to do it? Because there have to be certain limits. So, Chris in his lifestyle, some terminal. So let's say there's a guy named Chris and he gets some disease and, he's capped out at 1,000. I mean, you don't have unlimited resources. I mean, how does that work? That's one question. I got another one.
Yeah, I'll hit that one first. So,
Yeah.
so right, that 1,000. So I'll give an example to around that, and hopefully maybe this will help a little bit. So I always like kind of real examples in the real world. So one of our members, great guy, Chris, happen to name Chris. Yeah, sorry, Alan. Anyway, so he was from Alabama, decided to go skiing, joined us, said I'm going to go skiing out in Colorado.
I did, by the way.
And so when he was skiing in Colorado, he fell down and broke his neck. Bad day.
Durango didn't break my neck.
Did not break your neck, hopefully. Right. So bad issue. Gets life flighted to the local hospital there. Goes, I'm self-pay. Right. I'm going to pick the magic price on that hospital's charge master in Colorado and be self-pay. Said, I'm self-pay. They admitted him, stabilized his neck. Really bad day. Found out that he had cancer that had spread to his neck, and that's why he broke it so easy.
Oh,
bad day.
That's a bad day, bro.
Flown back down to Alabama. University of Alabama, Birmingham is right where he was. He was in Birmingham.
Good school.
Great place.
Great school.
Stabilized his neck, put him through radiation therapy, chemotherapy, treated his metastatic disease. He now wants to sell us. And the entire price, right? The charge master, right? The game that's this health insurance based world, $2.1 million.
2.1.
2.1 million. But he used the magic word, I'm self-pay, right? So you're on an insurance plan, premiums, right? High premiums going out to pay all of that money that I'm having to pay every month in this premium to overpay for that healthcare service that we bought as a self-pay customer for $650,000.
Check that one out. All right. So our fund, back to Alan's point, our fund has to pay that.
Yes.
So what if there's a lot of other
people that names rhyme with
right,
Chris falling
but
off?
For the record, but I'm a way better skier than this dude because I did not get hurt. I'm kidding. But no. So let's say there's a run on the fund. All right. Then what?
We raise our monthly contribution, right? Because the dollars are only going to pay for the healthcare for our members. And so we go, hey, if we have a bad run on our fund and we look at the spend on the fund, and as we get through our renewal process of re-upping businesses and individuals, we go, hey, we need to increase premiums. And,
right. And if there's less, is there
we don't reduce. We generally stay stable. We haven't reduced yet. So if I look back for the past 5 years, what have we increased our premiums? And we call them contributions. We increased 3% last year because, well, inflation's, if you haven't noticed, has been up a little bit.
Yeah, that's less than inflation.
Yeah. And then a couple of years before that, we did 10% because of that big inflationary push right after, the change of the office.
All right.
So we put money in our capital, but this is the beautiful piece, right? Our capital is not being distributed to shareholders. Right, where the money's, it's not being used to build huge, beautiful buildings in every major metropolitan area that hospitals, or the insurance companies do. As you mentioned, the mausoleums that are being built out here that are remarkable.
Mausoleums.
Yeah, it is a place of death, from my perspective. But
I love that. No, they're amazing. Yeah, I've been to a couple of them, and they are pretty amazing. All right,
one more question.
Yes.
Yeah, keep going, man. That's why we're here.
You got to be facing headwinds. I mean, when you drain the swamp doesn't want to be drained. And it fights back. What's happening out there?
No, that's a great question. So fortunately, thank you, man. We've been a little bit below the radar.
That won't last.
It won't last. And that's okay. And we've got some hedges right on we've done some things on the political side to actually create a little bit of bandwidth on us on creating, getting some legislation across the finish line that creates some barriers and protection. The other piece around this, right, is who pays for most of healthcare in the United States? Businesses do. And businesses are pretty powerful. And every politician has to, right, because it's really going to be a political play, right? Our product and the cost and the effectiveness of our product is so much better than anything you're going to be able to buy in the marketplace with Blue Cross, United, Cigna, and we call them the BUCAs out there. So the only way they can control us, right, is try to create legislation against us. Mm-hmm. But we step into businesses and we go, hey, by the way, we're going to help you save $15,000 and make sure every single one of your employees has a great healthcare solution. Or we're going to walk in your business and save you. We'll save businesses with 20 people $180,000, right? We go, we're going to save you a ton of money. We start growing business to business to business and putting all of that capital back into that local community and back into the pockets of those employees and back into the capital expenditures of those businesses. And every single one of those people vote. Why didn't they shut down, right? The taxi cab industry wanted to shut down Uber. Why didn't they? Because all those constituents for all those politicians took Uber. And if they shut down Uber, those politicians weren't going to have a job anymore.
Mm.
Right. So you create a great product that solves a major problem, right, for employers in this society of ours and individuals in this society and medicine in this society. You solve that. Come on, I'll be happy to take a fight. But that's one I'm not going to worry about winning. We might be David and Goliath a little bit, but I got my rock. And I'm not too worried that my rock's not going to take David down and Goliath down.
Alan,
Amen to that.
you like your rock?
Yeah, I like the rock.
Do you want to keep going?
No, I'm good.
No, man, we're going to rock this stuff out. All right. Hey, everybody. Bryan, where are, sorry, it's a Bryan. Doctor.
Yeah, you can call me Bryan.
Dr. Bryan. I know. What states are you in
just
today?
So our focus, so I'll hit you on this. Our focus is really kind of honestly the Georgia marketplace is our hyper focus right now. And by that, I'm really even talking about this major metropolitan Atlanta area is my hyper focus. I can't say a petri dish, but this is really where we're seeing ourselves to want to rapidly grow and expand. That being said, I mean, we're expanding in Florida, we're in Texas, we're in Alabama, we're in Tennessee, we're in South Carolina. So we've got our tentacles spreading out as we move along. But my focus is here.
All right. So listen, he's figuring it out. I know, as Ellen has said, we're in 15 continents, and I think we're in 25 planets now?
Yeah, a couple of galaxies.
Yeah,
for sure.
So, guys, if you're hearing this outside, what we're talking about, though, is revolutionary. This is a business model. This is a guy who, I'm a doctor. I was trained to be a doctor. I want to help my why. And I figured out something different. And then I saw something I didn't like. And he's a disruptor, right? That's how we make business happen. That's what small businesses do. And that's what he's talking about doing. If you're here in Georgia, dude, go look this guy up. Bryan Hill, HipNation. We'll put all the deets in the show notes. It's going to happen because this stuff is real stuff. Because I'm a believer, and it took me a long time. I'll be honest. This is one of those things where I don't sign up day one. The engineer in me has to figure it all out, and it's
exciting. I mean,
it is exciting.
Because
and I will tell you
the solution
what Bryan doesn't know is that actually two of my friends have signed up with him already. So because they're like, you already believe in it? I'm like, yeah. Well, so boom, yeah, they put their companies on it already because it's that good.
I mean, everybody either just is a part of the system, or then they go, oh, or we'll do a government plan, and neither of them work.
Yes,
and this is really exciting to
me.
Yeah,
this is the thing. Yeah, exactly. That you hit on right. So social educate or social what's the word?
Medicine.
Thank you. I know so many people coming from Canada that are working down here to get away from that.
And the narrative you're being told is, oh, it's great because it's free. Well, it's not. Nothing's free.
No.
And this, this, if you're 20 and you're healthy, yeah, it's great. But if you need a knee replaced, good luck. All
right. So back to Bryan's point, and I'm going to end here, and then we're going to ask him the famous 4 questions. Free market doctors is who I want to work with, right? Because they want to make as much money as they can because they're really good at what they do.
Yep.
What does everybody from Canada do? Come down to the U.S. and say, hey, I'm down here for the summer. Oh, my God, my eye hurt.
And by the way, we do love Canada.
We do love Canada. Hey, Canadians, I love you guys, right? I'm sorry that I'm bringing this up. So sorry.
Hockey's the best sport.
And actually, you're not going to joke with me on that one.
So much better.
The beer and the hockey is so much better. Yeah. But, and I went to school north of where most Canadians live.
That's true.
Michigan Tech. That's where I played football. All right. So that's where my 6'8" and 6'9" guys were with me. My pillars at every bar I went to as I wreaked havoc with everybody. All right, Doc, how can we find you online?
So our HipNation.com, that's HIP, P as in Paul, nation.com. Come to our website, take a look at what we're doing. If you're interested in learning more, hearing more, we've got a simple little click a button on the website, get a quote, have a conversation with our team. We are loving what we're doing to try to help make businesses better and provide a better solution to their employees.
Feel the passion, everybody. This is awesome. Coming through it. You're driving around your truck. You're figuring it out. If you hung with us this long, let's hang a little bit longer. Doc, what's the best book you would advise for a business book trying to scale a biz?
Business book. Good to Great, so old, but it is an oldie but goodie. So I think that's been very valuable. Walking Backwards, I found that as a really interesting book, and a book about Amazon. and kind of talks about how they approached, kind of looking at innovative ideas within Amazon and how they presented those to each other. So I think that's maybe one that I found very helpful.
Good one. Haven't heard that one before.
Well,
I like
that is a good one.
Yeah. I like the case study books anyway.
All right. The reason I said business, because I was afraid he was going to start bringing out some of your urology books. I'm like, I don't want to hear about those tools or the instruments or none of those.
The rusty saw.
Bite this. What? Bite down, son. You won't hear a thing. All right. Number 2. What's the favorite feature of your home?
Oh, my pool.
Oh, beautiful. Why?
Because it's just a place where my wife and I get to kind of escape into and just swim, and it's where we do our exercise, and it's just a place of solitude.
So do you have a swim up bar?
No swim up bar. Although I would say this, so my wife will laugh. So I'm more of a Scotch person. So we'll put a Scotch at the end, and we'll swim laps back and forth. And as you're swimming, you just stop at the end and sip on your Scotch and just keep on going back and forth.
I like this.
A doctor. Yeah.
He is my kind of doctor. I got a pool, and I just got to be we have a tanning bed, and we have a swim bar. But don't worry about that. All right, back to me.
Do I need that lie detector test again about the whole?
Enough about me. Let's talk about me.
Can we talk about me more?
Yeah.
All right, Doc. One of the big things, obviously, Alan and I have done a lot of home services stuff. I work in the home services industry. But one of the big things that we talk about, though, is customer service is huge everywhere. And when we're out there, we're kind of customer service
Freaks.
Exactly. What's a customer service pet peeve of yours?
Oh, everything that happens in medicine. So you walk into a physician's office. What's the very first thing they say to you?
Ask for your card.
What's your insurance card? Do they go, "Hi, Alan, welcome to my office.
Yeah.
Great to see
I was
you."
thinking about that
I'm missing
earlier
you.
when you were talking.
Yeah.
Can you fill this out again?
Yeah, fill this paperwork out again. You're like, I just filled it out like 3 months ago. Nothing's changed. Sorry, fill it out again. There's no customer service in
Because
healthcare.
the HIPAA.
Well, yeah, exactly. Well, it's really billing documents, right? And the reason why is why? Because it's not about you. It's about the insurance company. It tells you once again that when you walk in, they go, "What's your insurance card?" They're going to go, "I'm going to do what the insurance company tells me to do because they're my payer, not you." Get them out. So everything that happens in medicine, not everything, but medicine is pretty poor on the customer service side.
We all have to admit that's a pretty big pet peeve, right? I mean, every time you walk in there, like, I don't know you. But Sherry, I was here like a month ago, drawing blood because I don't have any issues, but I might have been there.
My liver might have been having some problems.
Yeah.
Hypothetically.
Actually,
Air
I brought my friend's blood. Can you use this? No, all right. All right, last one. Let's do it. Give us a DIY nightmare story. I want to hear how the doctor worked on his own house and almost lost his finger.
So to be honest with you, I'm smart enough to realize that I am a terrible DIY person, and my ability ends in the operating room. My toys work there, but I tell people if there's anything I need to do outside of that, I'm going to have to call somebody else in that's a lot smarter and skilled than I am.
Oh, I got a surgery question. So if you look at your schedule and you go, "Oh, tomorrow I get to do this procedure," which one gets you excited?
Oh, I love taking kidneys out with cameras. See, it's fun.
Holy shit, Paul. Dude, I was about to, you know what? One of my favorite ones, like when I hear, "Hey, we're going to span 23 feet that we engineered," that one gets me excited. He just said, "I take kidneys out with cameras." And I think on that one, we got to end. Oh my God. Get out of here. Go make it happen. Bryan Hill, Dr. Bryan Hill. Because he deserved it, man. 14 freaking years doing what he did. Dr. Bryan Hill, HipNation, making a difference. Go listen to this episode. If you didn't listen to it, listen again.
Well, they wouldn't be listening to it now if they weren't listening to it.
No, I think sometimes people pick up the last part for the next one. No,
I don't think that's how it works.
Shit. All right. We're out of here. Go make it a big day. Let's go.